Hi everyone, welcome to my channel. My name is Dr. WAN, and today we're gonna talk about drug administration. And the title for this clip will be, what are the 10 golden rules in medical administration? This clip is dedicated to medical students having trouble with medical administration. The duty of a medical administrator are highly crucial in the medical industry as they ensure patient safety and well-being. To handle these highly risky duty, medical administrators have set 10 golden rules and work accordingly. These 10 golden rules are the ultimate source of optimal patient health. However, the question is, what are the 10 golden rules in the medical administration? So here we go. Golden rules for medication administration. There are actually 10, and I'm going to explain more in detail what are these 10 rules, or call it 10 medication safety protocols. So, rule number 1, right patient. So you need to first of all get the right patient by doing some verification. So we say verification of patient's identity, collecting personal information, utilizing advanced technology and patient identifiers. So those are the 3 things to qualify for the right patient. Rule number 2 is the right medication. And for you to get the right medication, you have to double check protocols, highlighting errors in the medication prescriptions. Do also medication reconciliation. That is, if this patient is taking medication from different GPs or different hospitals or different healthcare professionals, you need to make sure that the patient needs the medication. That's the meaning of medication reconciliation. The next one is using barcode scanning system. If you look at the drug you have, there are some QR code. So you need to make sure that that's the right one. And then giving the right medication to the patient. So that's another key thing here. Rule number 3 is right dose. And for the right dose, administering the right dosage for patient safety. Otherwise, you might kill the patient that you are struggling to cure. Accurate measurements of prescriptions. Precise dosing protocols. So these are the 4 things that you must respect them to make sure that you are giving this patient the right dose. Rule number 4 is the right route. The right route here meaning that you need to start by exploring administration routes such as oral, intramuscular, etc. Identifying patient's condition and then choosing the right route. So these 2 things are highly needed. Rule number 5 is the right time. Administering medications at the right time is very important because some medication goes with the temperature of the day and also the time, the light, what we call chronopharmacology, like the statins, the simvastatins, atorvastatin, all those medication for cholesterol. You find some patients that you give them in the morning and some in the evening. Another thing is emphasizing the drawbacks of missing dosage. So once you miss your dose, you can take it when you remember, not that you have to double it. You don't double dosage of medication. There are some exceptional cases like what we call attack dose to start a therapy. But in the case where you miss your dose, I will say do not double the dose. Rule number 6, write documentation. It's very important also here, maintaining necessary records as a legal requirement. Recording name of medicines, dose intake timings, patient's reaction to the medication intake are very important. Here we talk of pharmacovigilance or drug safety, because some patients might take the medication and develop what we call allergies or some adverse drug reaction. Rule number 7, right to refuse. Accepting patient's refusal to medication. Patients have the right to refuse medication if they are mentally able to prove that. Foster open communication. You need to also communicate with the patient. There should be that communication, not just talking. Providing alternative medicines. That one is also good, what we call folks medicines. For instance, you have a situation where patients don't want to take simvastatin, they want an alternative. That one also, it is their right to do so. Rule number 8, right assessment. Thoroughly assess patient's condition. You don't just give drug without assessing patient's medical condition. So that one has to be done, then you get this medication administered. Check if medication accurately aligns with the assessed condition. So, some laboratory work has to be done, some clinical assessment has to be done before you go ahead to administer that medication. Otherwise, you can kill your patient. Rule number 9 is right education. Providing patients with all the information regarding the prescribed medications. So you need to actually educate your patient on the medication that you are about to give to him or her. That's a very important factor. Communicating the purpose and the possible side effects of the medicines administered. It will be wonderful for you to give patient heads up of a possible side effect occurring. It should not come as a surprise. So that's another good thing here, what I'm talking about, right education. And lastly, number 10, right evaluation. Monitor patients' response towards the medicines, meaning that you don't just give the drug and go away. You need to monitor this patient also, call back to find out how he or she is doing. That's the meaning here of evaluation. In case the patient is having some challenges, that medication can be withdrawn, or what we say, de-challenge and re-challenge. So we have the 3 words, challenge, de-challenge, and re-challenge. So meaning that you either withdraw the medication or you give the patient a lower dose. Then now you see how the patient behaves. Carefully evaluating whether there are any adverse effects on patients' health from medicine prescribed. That's another aspect, what we call drug safety. That one has to be done. As you all know, safety is number 1 when it comes to drug administration. And now, conclusion. Therefore, it can be concluded that the medication administration principles involve implementation of 10 golden rules as mentioned in the guide. These rules are not just guidelines for the medical administrators, they are compulsory part of the process, which ensures patient safety and well-being. So if you include these 10 golden rules in your medical administration process, then get ready to be praised for giving the best and optimal patient care service. Once more, thank you so much for listening to me. Like my channel, share it with others, and I'm more than happy to answer questions from medical students. Once more, my name is Dr. WAN. Thank you and bye-bye.